Something is being built underneath the White House right now, and the Trump administration is fighting in federal court to keep the details secret. Not a ballroom, not a storage room, a hospital, a full, state-of-the-art underground medical facility. And that's not a theory, that's straight from the administration's own court filings. At the exact same moment those documents are leaking out, the man who was Donald Trump's own White House lawyer is going on national television and saying the president is showing signs of dementia. And now Trump is heading back to Walter Reed for the third time this year. Something is going on. And today, on War and Wealth, we're going to follow the evidence wherever it leads. Stay right there, because what we're about to walk through isn't a collection of rumors. It's a pattern. And once you see it, you can't unsee it. Before we go any further, if you're new here, welcome to War and Wealth. Hit that subscribe button right now because we cover the stories that sit at the intersection of power, money, and national security. And right now, there's no bigger story than the question of who is actually running the most powerful country on earth. Subscribe, hit the bell, and let's get into it. Let's start with the building. In October 2025, the entire east wing of the White House was demolished. Gone. Reduced to rubble. The East Wing had stood since 1902, Teddy Roosevelt's era. More than a century of American history. And it came down in a matter of weeks. The Trump administration said it was making room for a grand ballroom, a 90,000 square foot expansion that eventually carried a price tag of at least $400 million. Historic preservation groups went to court to stop it, and that's when things got interesting. Because in those court filings documents that the Trump administration submitted to a federal judge, lawyers for the White House described what is actually being constructed underneath that ballroom. And it is not what anyone expected. The filings listed, among other things, bomb shelters, a hospital and medical area, protective partitioning, and top-secret military installations, structures, and equipment, missile-resistant steel columns, drone-proof roofing, bulletproof and blast-proof glass, biodefense systems, secure air handling, and a hospital, an actual hospital underground beneath the White House grounds. Trump himself confirmed it, standing in the Oval Office talking to reporters. He said, "We have biodefense all over. We have bomb shelters that we're building. We have a hospital and very major medical facilities that we're building." He said those words out loud, on camera. The administration wasn't denying the hospital. They were defending it as a national security necessity. So much so that when a federal judge ordered construction to pause, the Secret Service filed documents arguing that stopping the project would endanger national security. The Secret Service deputy director said that a classified declaration explained why and offered to share those classified details only in private with the judge. Now pause for a second and think about what that means. The Secret Service is arguing in court that this underground hospital complex is so critical to national security that they need it finished immediately, but they can only explain the real reason to a judge behind closed doors. The contractor they hired is Clark Construction, the same company that built the National Geospatial Intelligence Agency campus and the U.S. CENTCOM headquarters at MacDill Air Force Base. The lead architect brought in to design the project is Shalom Baranis, the man who rebuilt and hardened the Pentagon after September 11th. These are not the people you hire to build a nice ballroom. Historians and national security experts who've analyzed the project have made a pointed observation. The old bunker, officially called the Presidential Emergency Operations Center, was always designed for short-term use. The whole idea was to get the president out of Washington fast. You don't build a hospital for a president who plans to evacuate. You build a hospital for a president who may need extended care and cannot leave. That's a fundamentally different vision of what this facility is for. Keep that thought in mind as we move to the second piece of this puzzle. Ty Cobb is not some liberal pundit. He is not a Democratic strategist with an agenda. He is a man who worked inside the Trump White House as a special counsel. He defended the president during the Mueller investigation. He sat in the building. He knows what he saw. And in January 2026, Cobb went on television and said something that stopped a lot of people cold. "I think there's been a significant decline," Cobb told MSNBC's Ari Melber. "He's always been driven by narcissism. But I think the dementia and the cognitive decline are palpable, as do many experts, including many physicians." Palpable. His word. And he didn't stop there. Cobb described Trump as somebody who is just lost. He said Trump's vocabulary has shrunk, that he's resorted to profanity and threats, that his behavior suggests what Cobb called, in clinical terms, the absence of any frontal lobe controls. And then Cobb pointed to something specific, something you can verify yourself because it happens publicly on Truth Social, in the middle of the night. One of the classic symptoms of Alzheimer's, Cobb said, is the sleep-wake reversal. So we see these screeds coming out at 4 a.m., and we see him falling asleep at cabinet meetings in the mornings and in the afternoon. That's a classic symptom of dementia. Sleep-wake reversal. Posts going out at 2 in the morning, 4 in the morning, and then cameras catching the president apparently nodding off during official meetings. Cobb isn't diagnosing Trump, he made that clear. But he argued that what he was describing fits patterns that many doctors and mental health professionals would recognize. By March 2026, Cobb was even more direct. On CNN's Jim Acosta show, he said Trump's late-night Truth Social posts showed what he called the level of his insanity and depravity. When Acosta asked him simply, "You think he's just gone?" Cobb answered, "I think he's gone." Now, the White House's response to all of this has been predictably sharp. Communications Director Stephen Chung called Cobb an eternal stain on the great name he shares with a baseball legend. Trump himself has repeatedly insisted he is in perfect health and claims to have aced every cognitive test he's taken. There is no official diagnosis. No public medical records confirm what Cobb is saying. We want to be clear about that. This is not settled medical fact. It's the view of one former insider, and the White House rejects it entirely. But the questions don't stop at Ty Cobb. In early 2026, cardiologist Dr. Jonathan Reiner, who served as the personal cardiologist for former Vice President Dick Cheney, publicly called for a congressional inquiry into Trump's fitness for office. Mary Trump, the president's own niece and a trained psychologist, has said she sees in her uncle the same symptoms she witnessed in his late father, Fred Trump Sr., who was diagnosed with dementia toward the end of his life. A Washington State University professor, appearing on a public podcast in January 2026, went further suggesting, based on observed changes in Trump's gait, speech patterns, and posture, that the president may have suffered an undisclosed stroke. He pointed to Trump's foot-shuffling gait, his habit of cradling his right hand with his left, and verbal slips not seen in earlier years. That analysis is speculative based on public video, not a medical examination, and the White House has categorically denied any undisclosed medical events. But those observations are part of a growing, documented public conversation. A YouGov survey conducted in September 2025 found that nearly 2/3 of Americans believe Trump's age and health are affecting his ability to govern. About 49% said they believe he is experiencing a cognitive and physical decline. That's not a fringe opinion anymore. That's approaching a majority of the country. Now let's talk about Walter Reed. Trump had his annual physical in April 2025. That is standard. Presidents do that. But then in October 2025, just 6 months later, the White House announced he was returning to Walter Reed for what they called a scheduled follow-up evaluation. When reporters pressed Press Secretary Caroline Leavitt on why the president was getting a second yearly checkup just 6 months after the first, she described it as a routine yearly checkup. That same day, Trump called it a semi-annual physical. Those two answers don't say the same thing. His physician's memo said Trump was in exceptional health, exhibiting strong cardiovascular, pulmonary, neurological, and physical performance. The White House pointed to that memo and told everyone to move on. But now, here in May 2026, Trump is scheduled to head back to Walter Reed again, reportedly for his annual physical and dental work. Here's what raises questions. He already had what the White House called his annual physical in October 2025. He has reportedly already been to the dentist twice in 2026. The White House has a dental suite on its own grounds. So why does the president keep traveling to a military hospital in Bethesda for checkups that, by any normal standard, don't require that kind of trip? The pattern doesn't go unnoticed. Between early April 2nd and April 4th of this year, Trump made no public appearances for several days running. Speculation flooded social media that he had been hospitalized. The White House denied it. But the back-to-back silences, combined with the escalating visit schedule, have prompted congressional Democrats to send a letter to Trump's White House physician urging the release of detailed cognitive screening results and medication information. That letter has not been publicly answered as of the time this script was written. And here's what ties it all together. The hospital being built underground. The warnings from his own former lawyer, the accelerating visit schedule to Walter Reed. An analyst who reviewed the White House construction project documents made this observation. A continuity of care facility for a president who can evacuate is a known, solved problem. You move the president. You have protocols. You have secure locations. The only scenario where you need a full hospital installed inside the White House itself is a scenario where the president cannot leave, not for hours, but for an extended period of time. That is a fundamentally different calculation about presidential health than anything we've seen before. Now, we're not telling you what to conclude from that. We're telling you what the documented evidence shows. The administration's own lawyers described the medical facility in federal court. Trump described it on camera in the Oval Office. The Secret Service says it's a national security requirement so sensitive that the real explanation can only be given to a judge in a classified private session. And that is a remarkable posture for any administration to take on a question that is, at its core, about the health and capability of the person the American people elected. The men and women who built this country designed the presidency to be accountable. The Constitution doesn't just give Americans the right to know who their president is, it embeds an expectation that they know whether that president is capable of exercising the enormous powers of that office. That's not partisan, that's not political, that's foundational. George Washington set the precedent of stepping aside. The 25th Amendment exists precisely because the founders and their successors understood that the question of presidential fitness is too important to be handled through silence and spin. And right now, the people raising these questions include a former White House lawyer who worked directly for this president, a former cardiologist to a sitting vice president, a member of the president's own family, and a near majority of the American public. That is not a fringe movement. That is a national conversation that the White House has chosen to answer with dismissal, deflection, and classified declarations. We're not saying Donald Trump is incapacitated. We are saying that the evidence that is publicly available, court filings, recorded presidential statements, verified medical visit logs, polling data, and the on-record statements of former insiders adds up to something that deserves a real answer, not a press secretary's talking point, a real, transparent, verifiable answer. At 79 years old, approaching 80, an age no sitting president in American history has ever reached while in office, these questions are not irresponsible. They are mandatory. History doesn't always announce itself with a headline. Sometimes it builds quietly, underground, while the cameras are pointed somewhere else. Sometimes the most important stories are not the ones being shouted from the front page. They're the ones buried in court filings, written in late-night social media rants, found in the growing frequency of hospital visits that don't quite add up. They're the questions that powerful people hope you won't ask because they don't have a clean answer. We're going to keep watching this story closely, because whether you support Donald Trump or oppose him, whether you voted for him twice or never once, the question of presidential fitness is not political. It is constitutional. It is American. And War and Wealth will be here every single time a new piece of this puzzle comes to light. If this video gave you something to think about, something you didn't have before you hit play, do us a favor right now. Drop a comment below and tell us what you think is really going on. Is the underground hospital legitimate national security infrastructure, or does it tell a different story? Do you think the White House is being fully transparent about the president's health? Your perspective matters in this conversation, and we read every comment this community leaves. And if you haven't subscribed yet, what are you waiting for? Hit that subscribe button, share this video with someone who needs to see it, and hit that notification bell so you don't miss what's coming next. Because on War and Wealth, we don't chase the noise. We follow the evidence. And right now, the evidence is pointing somewhere very few people are willing to look. This is War and Wealth. Stay sharp, stay informed, and we'll see you in the next one.